My name is Russell Wagner. I'm the Residency Program Director for Orthopedic Surgery at John Peter Smith Hospital.
Dr. Wagner is the epitome of the JPS mission. He spent his entire career doing the right thing for patients and going above and beyond and doing heroic surgeries that other people would be terrified to do because it's what the patients needed.
Dr. Wagner is a dear friend of mine, mentor, former colleague. He just recently retired in June as our program director.
I've been here since 2002, I guess, when I think back when I was a resident here. And I got to work with Dr. Wagner since 2002. I think the bar has really been raised over the last 20 years or so since he was here with us. He was always big about reading the literature, always big about staying up on what's new in orthopedics, and really drove that through with the residents. And I'm proud to say that we turn out good residents. They know how to operate, they know how to take care of patients, and overall they treat people the right way, and I think that's very important.
Yeah, I think the reason this program is so successful, and frankly the reason it still exists, is because of Russ Wagner. He was the one who really came in and took a program that had this loose network of community surgeons that would come and volunteer their time to teach the residents here at JPS every once in a while, to a cutting-edge program where we have dedicated full-time faculty in every subspecialty within orthopedics. And I think that he created a sustainable program here and truly created one of the best surgical training programs in the country in orthopedic surgery.
I just can't overstate what an impact he has had for the orthopedic surgery residency here at John Peter Smith Hospital. It was a good program, but he took it from good to great. He really took us to the next level as far as regional and national accord. He elevated the focus on patient safety, patient experience, resident learning. All the things that we are today, I can directly attribute to Russ Wagner's work.
Being a great surgeon and being a good person are not mutually exclusive, and that when you're in the OR, your focus is on excellence, but that doesn't stop when you're in the OR. What Dr. Wagner showed is that when you leave the OR, that doesn't stop. It doesn't stop even when you leave work, that having the ability to prioritize your family and prioritize your faith, but also prioritize your patients is possible. And he lived that, and he demonstrated that. And I think that was the strongest thing that he did, was really live what he preached. And that you can be dedicated to your patients and be dedicated to your family and be successful in all of those aspects, and that, again, they're not mutually exclusive. And I think having that as a role model for especially young surgeons is incredibly important.
We talk about it's a family-oriented program. We are a family here when we come to work. We have a great mission here. We take care of people that need us. We take care of the ones that can't find care other places, anybody that comes in the door. And Dr. Wagner was that type of person that brought that to us. He never turned down a patient. He never turned down a case that was too difficult. He took on what came in the door and did the best work. And so I think that set the standard for all of us to be able to follow over all these years.
They're big shoes to fill, I'll tell you that much. I am so grateful, though, for his legacy, because I was able to inherit a program that is very firmly on the tracks, right? I didn't have to build the tracks or put the train on the tracks. We're moving in a very good direction, and for that I'm grateful. I do feel a tremendous responsibility to fill his shoes appropriately. I don't know that I ever will, but I'll do my best. And if I can be half the program director, half the surgeon, and half the man that Russ Wagner is, I'll be immensely grateful.